It's David Vitulis from Batavian Medici Latin. I'm the CEO of Profitami. Um, the There were 103 shepherd traditions that were summarized after 1910 into just two medical sects, and they're all good people. They're physicians. We know as medical doctor and as osteopath. However, there's 101 other traditions that have different accounting systems that are tied to medicine, that were based on the Hippocratic Oath. One of them was the Jagphetic system of horse shepherds, which was the origin of Hippocrates, it was the origin of zoology, caring for large animals. It was the origin of health care because it was the source of equity and large markets. Large market economies originated from that tribe. That happens to be really important because there are financial instruments that used to be that have been lost, and among those include quitclaim deeds in a medical setting that increase the quality and safety of the facility. That would be qualitatively similar to a management agreement, qualitatively different though, because it is predicated based on the quality, as a unification of quality and finance. And so it is this Regulus, of which it is the regulation, the unification of law with the healthcare kingdom, of which healthcare has 5 levels of regulation. There's regulation at the quatrinary level. There's regulation at the tertiary level. There's regulation at the secondary level. Regulation at the primary care level. And there is also regulation in the public realm, public health realm. And each of those settings are so important because there are assets that are attainable in the form of quitclaim deeds. Every facility that does any qualitative kind of, we call it entulus, which is the ancient Jagphetic word, such as gastroenterology. Entulus absolutely has assets at every facility that engages in procedures similar to that. From the quatrinary setting, tertiary setting, secondary setting, primary setting, and public health setting. And that happens to be so important in how to run and operate a perfect healthcare system. That idea originates for me, and as part of the knowledge that originates from Perfecting the Brand American Medicine, my book. The second area that's very interesting is orthopedics, because again, places that have that unification of quality and finance, whether it's quaternary, tertiary, secondary, primary, or in the public realm, there are all of these quitclaim deeds that increase quality and safety for patients. A third area is in dermatology, in what we call thermulus. Looking back at the old Jagphetic language, the kingdom of people's skin, basically. And those quitclaim deeds are available for sale for increasing the quality and finance, the unification of quality and finance within within our nation. And the same happens to be true for the guiulus, of which guiulus is an ancient word that means to pour. To pour is the old Jagphetic word meaning for gu. Gu is to pour, which is the infection prevention methods across all those settings. Of which that's some of what accreditors do. Our accrediting agency has been more successful. The Hippocratic Knighthood Commission has been far more successful. We functioned more like a magistrate judge with our clients, more like a board chair with our clients, rather than being a distant accreditor with like a checklist. We've been far more successful. For example, 40% of all the opioid prescriptions in America pass through our algorithm. That helps protect our physicians from malpractice. That's the benefit of a Regulus, is having a Regulus by specialty allows us to reclaim the field of law with medical science, with law, with medicine. Because see, the hierarchy of learning was learning law and medicine, and medical science. Those were kind of the pinnacle. And that changed after the Civil War, because see, the Civil War was a traumatic period of time when we lost all of our different legal sects, of which our founders included people of multiple different legal sects, including those that were reading lawyers, those that were physicians, those that were medical scientists. Benjamin Franklin comes to mind. Those that were knights, and those that were artillery officers, that were functioned as lawyers. The American Revolution was filled with artillery officers that were functioning as lawyers, because they're at war with the King of England. You know what I mean? So they were inventing a new law everywhere they went. And so this happens to be important in reducing your malpractice risk, because there are so many steps that can be taken to codify physician, healthcare, hospital Regulus, based on the neurosystems, the irreducible neurosystems. Each of those neurosystems are different. They're naturally different. There are natural differences between them. And it's an exciting period of time to have a new unification of medicine and law. Join us at Batavian Medici Latin to learn more.